Pneumoperitoneum refers to the presence of air or gas in the peritoneal cavity, which can be a sign of perforated hollow whiskers. For example, stomach, intestines. Perforation is a medical emergency, and recognizing the signs is crucial for quick diagnosis and treatment. Key signs and symptoms include abdominal pain. This often described as a sharp or stabbing, typically starting at the site of perforation and becoming generalized. The pain may be initially be localized, but can spread as peritonitis develops. Next is rigid and guarding. The abdominal may feel hard and rigid due to involuntary muscle spasm. The patient may tense their abdominal muscles to protect the area. This is what we call guarding. Pain worsen with pressure is released after palpation of the abdominal. This is what we call the rebound tenderness. Um, could we have fever, which indicate infection or inflammation? Tachycardia, which means we know the elevated heart rate due to the pain or sepsis. Hypotension may occur if sepsis or sepsis shock develops. Those are systemic signs. Nausea and vomiting commonly occur due to the irritation of the perineum. Absent bowel sound may indicate ileus. Those are GI signs. Signs of shock such as a cold, clammy skin, as we know due to the poor perforation, confusion or altered mental status in severe cases. Free air under the diaphragm seen on the upright chest X-ray or CT scan, which is a classic sign of peritoneum, or antidependently in the abdominal cavity anywhere. Labs such as increased WBC, elevated lactate may suggest tissue hypoxia, infection, or even sepsis. The history of risk factors are very important. We need to consider recent trauma, surgery, or procedures such as endoscopy. Conditions like peptic ulcer disease, diverticulitis, or inflammatory bowel disease (IBM) as considerations. For summary, peritoneum is a life-threatening surgical emergency. If someone is experiencing these symptoms, immediately medical attention is required. The diagnosis is confirmed objectively by the imaging, such as the erect chest X-ray showing air under the diaphragm, CT scan, and the physical exam findings such as board-like rigidity, absent bowel sound. So treatment typically involves surgical procedures to repair the perforation and manage any resulting infection or complications.